Hello guys, so we are done with the discussion of Candida albicans. Now we shall be discussing the second opportunistic fungal infection or opportunistic mycosis, that is Aspergillus fumigatus. Okay, so we shall be focusing now on Aspergillus fumigatus. Now, in this Aspergillus fumigatus, few important things you definitely have to know. What are these few important things is that, first of all, we shall be discussing about the morphology. Now, when you look at the morphology, obviously as this is a fungal infection, even they produce hyphae, right? And we have to know whether these hyphae are branched or unbranched. Obviously, the hyphae of this Aspergillus fumigatus are branched. Okay, so they have got hyphae which are branched, and by the way, we also have to know whether this hyphae is septate or not. But anyways, let me draw a picture first. Okay, so let us say that this is the hyphae over here. So this is how the hyphae looks, right? Now this hyphae is having septa in between. Now if they are having septa in between, so what should I call it as? I should call it as septate hyphae, right? So the first important thing I would write here is, obviously this is a septate branched hyphae. What is this? This is a septate and a branched hyphae. Okay, so this would be a septate as well as a branched hyphae. When I'm telling that it is a branched hyphae, so you have to know at what angle is it branching. So look here guys, if you look at the angles at which it is branching, these angles are acute angles, right? So I can say this angle is about 45 degrees. 45 degrees is an acute angle, isn't it? So let us say this angle is your 90-degree angle. Okay, so what do you mean by acute angle? If it is branching like this is 45 degrees. This is called as an acute angle. So these branchings are acute angles, So simply remember like this: acute angle AA is for Aspergillus fumigatus. Okay, so Aspergillus is A, branching at acute angles. So it has got a septate hyphae. Clear? Anyways, I'll show you the picture of that. So switching on to the next important thing. Next important thing is that these Aspergillus fumigatus hyphae, they have something called as conidiophore. Okay, so what I'm telling is, for example, this is the hyphae like this. They have something like this. Okay, these structures. They have structures like this. Okay, now these structures from here all the way till here, whatever I've drawn, this is called as conidiophore. And obviously don't forget to draw septa in between, right? So this is a septate hyphae. It has got conidiophore. Now at the tip of the conidiophore, there are some things that are getting released. Look here. There are some small round structures, round bud-like structures. They are emerging from this conidiophore, right? So these small rounded structures which are emerging from this conidiophore, how are they emerging, guys? They are emerging in the form of a radiating spikes, right? So in the form of radiation spike or radiating spikes, they are emerging there. So what are these small buds which are released out of this conidiophore? These are called as conidia. And how are they emerging? They are emerging as a radiating spikes. Okay, so this is the basic thing which you need to know. Now when it comes to the diseases, so let me show you the picture and then we shall go for the diseases. Look at the picture, guys. Look at the picture here. Let me show you the first picture over here, right? So in this picture, what can you see, guys? You can see that they are branching at acute angles, isn't it? You see this? They are branching at acute angles. Let me use another color which is clearly seen. Yeah. You see, they are branching at acute angles like this. Acute angles over here. Isn't it? They are branching like this, not like this. They are branching like this, acute angles. Second important thing is that this picture which you can see over here, right? So this thing and this thing is called as a conidiophore. Conidiophore. And what are these? These are called as conidia. These are called as conidia. The radiating process, right? They are radiating like spikes like this. So these are called as conidia. Now, when we discuss about the diseases that are caused by this Aspergillus fumigatus, when we discuss about the diseases that are caused by this Aspergillus fumigatus, there are three important diseases. Okay, so there are three important diseases that are caused. What are these three important diseases? The first important disease is invasive aspergillosis. Invasive aspergillosis. The second one is aspergillomas. The second disease is aspergillomas. And the third disease is allergic bronchopulmonary aspergillosis. Aspergillosis, simply called as ABPA. Allergic bronchopulmonary aspergillosis. Now, what are the three different types, guys? One is called as invasive aspergillosis. Another one is called as aspergillomas, which is also called as fungal ball. And third important thing is allergic bronchopulmonary aspergillosis. Now, we shall be discussing about all these three of things. Okay, all these three things we shall be discussing. Now, we shall be discussing about all these three things. So, first important thing we have to discuss is invasive aspergillosis. Now, when you discuss about invasive aspergillosis, what is the important thing you need to know? The first important thing you need to know in this invasive aspergillosis is which group of patients do you see this infection of invasive aspergillosis? Okay, so Aspergillus fumigatus mainly affects which group of patients? Okay, so it mainly affects two groups of patients. Now, who are these two groups of patients? The first group are called as immunocompromised patients. Who are immunocompromised? Those patients whose neutrophil count is low. Those patients whose neutrophil count is low, or those patients who have got HIV. So these group of the patients, these group are the patients who are called as immunocompromised, right? So mostly invasive aspergillosis affects those who are neutropenic, because neutrophils are the main cells of your immunity, right? So neutropenia or neutropenic, patients who are neutropenic. Next, you will also see in those patients who have a disease called as chronic granulomatous disease. Now, you have studied this basically in your pathology, okay? But anyways, I have explained in bacteriology also what is chronic granulomatous disease. So please watch those videos. So patients with chronic granulomatous disease. So patients with chronic granulomatous disease and patients with immunocompromised. Chronic granulomatous and immunocompromised, these two groups of the patients are most commonly susceptible to invasive aspergillosis. Now, in these patients with invasive aspergillosis, what is the important symptom which you will find? So, in these patients, you will find granuloma formation within the lungs. Okay, you will find very big granulomas that are formed in the lungs. So, you would see lung granuloma. Along with this lung granuloma, patient will also have fever because there is infection in the lungs. So patient will have fever. There is infection in the lungs, so patient will have pleuritic chest pain. Pleuritic chest pain. And not only that, as there is infection in the lung, patient will also have hemoptysis. So overall, what are the symptoms? Patient will have, if you find in the question paper that he is explaining that there is some kind of lung granuloma, along with that there is fever, pleuritic chest pain and hemoptysis, that would be Aspergillus fumigatus infection. Okay. Now, how does this infection basically spread? Basically, this Aspergillus, whatever is there, right? So this Aspergillus mainly spreads through blood. I mean hematogenously. Okay. Let us take an example. This is a blood vessel over here, right? So this is a blood vessel which is supplying to the skin. This is the blood vessel which is supplying to the kidneys, which is supplying to your brain, and which is supplying to your liver as well. Okay. This is the blood vessel which is supplying to the skin. It is supplying to the brain. It is supplying to the kidneys, and it is also supplying to your endocardium. Okay. Now, first of all, what will happen is that these Aspergillus spores, whatever are there, right, this fungus spreads very fastly hematogenously, and what will happen, it will affect your skin. Not only that, it would cause infection and infarction of your skin. Infection and infarction of the skin, infection and infarction of your brain tissue, of your brain as well. It will also cause infection and infarction of your paranasal sinuses. I hope all of you know what are your paranasal sinuses. Surrounding the nose, whatever sinuses are there, like frontal sinus, right, maxillary sinus and all, ethmoid sinus, all these are paranasal sinuses. So it will also affect your paranasal sinuses. Apart from this, it will also affect your endocardium. So what I was telling you, that it would cause not only infection, it would cause infection and infarction. I hope all of you know what is infarction, right? So it would cause infection and infarction to all these tissues in your body. So basically, what will be the treatment which you would give, guys? What would be the treatment which you will give? You basically give amphotericin B. So what is the treatment which you give? You give amphotericin B. Amphotericin B is the treatment which you give. Now let us discuss the second disease. So the first disease was invasive aspergillosis. Where did it invade? It invaded into the lungs. Now the second disease is aspergillomas. Second disease is aspergillomas, which you also call it as a fungal ball. What do you call it as? You call it as a fungal ball, right? So what are aspergillomas? Aspergillomas are also a kind of, Aspergillus fumigatus infection. This is also Aspergillus fumigatus infection, but what happens is that, for example, let us say I am a patient, I have a TB. Now, whenever I have TB, there will be cavities which will be formed in my lung. You know that. So, there are high chances that within those cavities, only these fungal balls are formed. So, aspergillomas, where do you see? You see in a patient with a pre-existing cavity because of TB. Okay. So, where do you see aspergillomas? You see in a patient with a pre-existing lung cavity because of TB. Okay. So, let me show you an X-ray of that. So, as you can see an X-ray over here, guys. So, here patient is already having a lung cavity. Okay. See, patient is already having a lung cavity. Within this lung cavity, you can see a fungal ball that is developed over here, right? So, this is nothing but called as aspergilloma, right? So patient is already having a lung cavity, a pre-existing lung cavity. Within this pre-existing lung cavity, because of TB, patient is having a fungal ball, that is Aspergilloma. Right. Let us discuss the third important disease that is caused by Aspergillus fumigatus, that is allergic bronchopulmonary Aspergillosis. Allergic bronchopulmonary Aspergillosis, simply called as ABPA. Okay, allergic bronchopulmonary Aspergillosis, simply called as ABPA. Now, what is the important thing you need to know here? The important thing is that most commonly, what do I see, guys? When you read this term allergic, it is something related with the allergy, obviously. Bronchopulmonary, it means something related with the allergy of the lungs. So, can you tell me what are the most common allergies which you see in the lungs? One is asthma, and next one is cystic fibrosis, right? So, this ABPA is most commonly seen in two cases. One is asthma patients, one is patients with asthma, and the patients with cystic fibrosis. So in these two patients, you will most commonly see this ABPA, right? Now in these patients, look here, what will happen is that, let us say these are the airways. These are the airways. All of you know that within this airways, you have got some blue color cells which I am drawing here. Actually, they are not blue, I am just differentiating them. So, these cells are called as goblet cells. And what is the function of goblet cells? Obviously, goblet cells will release a lot of mucus. Whenever there is infection or whenever there is any kind of allergic inflammation, what will happen is that the number of goblet cells will be increased, the size of the goblet cells will be increased, and the mucus which is released by the goblet cells will also increase. So, what will happen is that whenever there is A for Aspergillus, okay? Whenever there is any kind of Aspergillus that has got inhaled, for example, I have inhaled spores of conidia of this Aspergillus, okay, that conidial spores whatever are there, I have inhaled. When I have inhaled them, they are foreign to my body. So obviously the lungs, what will happen is that the number of cells in the lungs will be increased. The number of goblet cells will be increased, the amount of mucus will be increased, and a lot of alveolar macrophages come there, lot of immune cells come there to kill that spores and all, right, to kill that foreign body. So what is happening here? What is happening here is there is intense airway inflammation. There is intense airway inflammation. Not only intense airway inflammation, apart from that, there is also mucus plugging. There is also mucus plugging, right? So, intense airway inflammation and mucus plugging, if it happens in a person, that is called as exacerbation, right? So, that is what mainly happens in the patients of asthma, right? In the asthma patients, what will happen? There will be bronchial smooth muscles vasospasm, right? There will be because of the inflammation and all. So, patient will have exacerbation. So, in these patients also you would see exacerbation. You would see exacerbation. Okay, but if I say repeated exacerbations in these patients, that would lead to a condition called as bronchiectasis. I hope all of you know what is bronchiectasis, right? Permanent and abnormal dilation of your airways is called as bronchiectasis. Now, what will be the symptoms in these patients? The first important symptom is that as the airway is completely plugged with the mucus, so there is a lot of mucus here. So there is a lot of mucus over here. The lumen is very narrow. So patient can't breathe the air. Even if he is breathing, you will listen to loud wheezes, right? So you would listen to wheezes. There will be wheezing. Second important thing is that whatever these pulmonary infiltrates are there, right? Let us say the infection has reached the lungs here. Now this infection will not stay here. It will migrate to another place. From here the infection will migrate to a third place like this. So these pulmonary infiltrates are migrating. So you call it as migratory pulmonary infiltrates. Migratory pulmonary infiltrates. Okay, when you do the blood checkup, obviously it is allergic reaction. So what do you see? You see neutrophils or basophils or eosinophils. Obviously in any kind of allergic and parasitic infections, you will see high concentration of eosinophils. Remember again, any kind of allergic reaction or any kind of parasitic infections in your body, you will definitely see a raised count of eosinophils. The patient will have eosinophilia. Patient will have what? Eosinophilia. Fourth important thing, what kind of antibodies are increased, they would ask you in the exam. Obviously there are two different types. One is IgE and another type is IgG. These are the two antibody groups which are increased. So when there is excess amount of inflammation, the only medicine which we give, what is the only treatment which we do when there is excess amount of inflammation? Obviously we give steroids. Steroids, like corticosteroids. Okay. Now another important thing you need to know is that there are some species of Aspergillus. There are some specific species of Aspergillus, and these species they produce special toxins called as aflatoxins. And what are these aflatoxins responsible for causing? They are responsible for causing hepatocellular carcinoma. This is very important MCQ, keep this thing in mind. Aflatoxins are responsible for causing HCC, that is hepatocellular carcinoma. So this is all regarding the Aspergillus fumigatus guys. Thank you so much for watching my video. Goodbye.